eingesetzt?
هنا كما ترون عدد الساعات اللازمة أو التي يعني نعم وكله باللغة الإنجليزية.
So, und jetzt kommen noch die Kontraindikationen dazu. Ich meine, es muss ja auch irgendwas verboten sein mit der Maschine. Schwangerschaft zum Beispiel ist eine Kontraindikation. Schwangerschaft, wenn jemand schwanger ist, dann darf er nicht in der Maschine behandelt werden.
عندما تكون المرأة حامل لا يجوز طبعا يعني علاجها بهذه الطريقة أو بهذه الآلة.
Eine Krebserkrankung im Behandlungsbereich.
أيضا الأمراض السرطانية عندما تكون قيد العلاج لا يمكن يعني استخدام هذه الطرق العلاجية.
Ein Herzschrittmacher im Behandlungsbereich.
Herz.
Ja, Pacemaker.
ومرض القلب عندما يكون أيضا قيد العلاج.
Oder sonstige elektronische Geräte im Körper.
أو عند استخدام أي أجهزة إلكترونية طبية في الجسم لا يجوز استخدام هذه الطريقة.
Keine Kontraindikation sind wie bei einem MRI-Verfahren Metallteile im Körper, wie zum Beispiel ein Nagel, der in einem Bein eingearbeitet.
أما إذا كان يعني في مواد معدنية في الجسم مثل الذي يضعونها في الساق يجوز العلاج يعني لا يوجد تأثير سلبي.
Oder ein künstliches Gelenk und das zweite ist noch nicht ausgetauscht und wird behandelt.
عندما توضع أسلاك أو يعني بدائل معدنية في الجسم ممكن العلاج حتى قبل إخراجها.
Oder Stents, Gefäßstützen ist auch kein Problem.
Was ist das?
Eine Gefäßstütze. Lassen wir es weg.
Gefäß?
Das ist praktisch ein Gitter, was im Gefäß. Nee, lass muss gut sein.
Okay. بعض الأمور يعني بالنسبة لي معقدة أنا حقوقي ولست طبيب.
Grundsätzlich gibt es bei der Kernspinresonanztherapie wenig bzw. überhaupt keine Nebenwirkungen, die wie es normalerweise bei Medikamenten bekannt sind, sondern das sind alles nur Ausschlusskriterien, was nicht behandelt werden sollte. Nebenwirkungen sind nicht bekannt.
الآثار الجانبية لحد الآن غير معروفة أو يعني لم تحصل آثار جانبية ممكن يعني أخذها بعين الاعتبار.
So, jetzt stehe ich.
أنا تحت تصرفكم إذا في حال وجود أسئلة. Yes.
Müssen wir das Mikrofon tauschen?
Das jetzt ein bisschen in Englisch Management.
Das war scheiße. Was meinen Sie?
Ein bisschen Englisch
Just
Management.
please would like to complete the session in English to have a direct conversation from Mr. Gruber to Mr. Munterman, if you please.
Just I want to ask a question about the MRT. Really, in the future, can it replaces the knee and hip replacement?
Könnte es in der Zukunft mit dieser Therapie ein Ersatz sein für eine Surgical, für eine Operation?
Also wir gehen davon aus, wenn ein Knorpelschaden entstanden ist.
So we assumed if you have a damaged cartilage, for example,
und sofort MBST eingesetzt wird nach dem Unfall,
and straight from the first time after an accident, for example, you're using MBST,
dass theoretisch die Arthrose sehr wahrscheinlich gar nicht zustande
then
kommen
on the
wird.
theoretical side, you wouldn't suffer an arthrosis as well. So you solve it before they start.
Wie wirksam die Behandlung ist, zeigt interne Untersuchungen, wobei bis zu 8 Jahren die Haltbarkeit bestehen.
How successful the treatment will be, the therapy will be, show that we have also studies that have an observation time above 8 years.
Wobei
And we have influence into the body during the whole line.
das heißt also nicht ständiges Wiederholen, sondern entsprechend eine einmalige Ausrichtung und ein neu geordneter Prozess im Körper.
Therefore, it's not necessary to do this therapy a second time. One-time therapy, 7 hours in cartilage treatment and 10 hours in bone treatment is quite enough for the whole suffering time. You solve the problem in 10 hours.
This means that if I want to do a hip replacement surgery, I may delay it till I do, for example, 10 hours MRT, and this would be okay?
If your question will be if you have to have a surgical, then No, that brings you back from the problem that you maybe in 15 years have another surgery. Because before surgery it will solve the problem. If you go to prevention, it solves the problem because before it comes up. You see, that's the issue what we have. You have a treatment and you have a prevention time.
A future modality for knee and hip replacement therapy.
Wenn wir die Arthrosestufen betrachten, umso mehr es auf eine Operation zugeht, umso mehr muss ich tun, um praktisch den Prozess abzufangen.
If we look at the stages of arthrosis, 1, 2, 3, 4, as long as the process of illness stays, as longer you need to solve the problem. And never ever you will deny all surgical. That's impossible. But as far as stage 1, 2, 3 is concerned, you will solve it. As far as stage 4 is concerned, there may be what we say the last try before a surgical. It may go on and maybe not.
Viele Patienten machen kurz vor einer Operation den letzten Versuch, um sie noch zu verhindern, und es klappt.
A lot of patients try the last try before surgical and stage 4, for example. Some of them in stage 4 succeed, some of them failed. Stage 1 to 3 it works.
Orthopedic surgeon, thanks for coming over and explaining such a beautiful technique. My question is, according to you, you use it for stage 1, 2, 3, and you may try it in stage 4. What, in your experience, what's the percentage of success in each stage? And can you use it in other conditions, like you showed the avascular necrosis, osteonecrosis? What about osteochondral fragments, osteochondral defects? And also, is there a place for repeating the therapy if it doesn't work?
Wenn Sie die Stufe 1 sehen, annähernd 100.
If you look at the stage 1 of osteoporosis, you may nearly 100%.
Bei Stufe 2 und 3, je nach Diagnosequalität, 80 bis 90%.
If you have a look on stage 2 or 3, it belongs to diagnosis and how long the patient suffers. And we have nearly 80% success. And to the second question what you have,
in anderen Krankheitsbildern, wie viel Prozent der Erfolge haben wir in anderen Krankheitsbildern, die wir schon bewiesen haben?
Osteoporose gleich.
As far as osteoporosis is concerned, we have nearly the same success, that may be 80%. As I explained, therefore, that we measure some frequencies, and 80% of our frequencies are nearly equal. 10% may be below on the one hand, and another 10% below above the other side. So we can only have a target of 80% belongs to the measured frequency.
Thank you very much for that magic solution for the arthritis. But my question is, what about the interarticular space? I mean, the narrow intervertebral space affect the therapy or not? The narrowing of the space, interarticular space. And second question, how much the cost if we are going to be done in Germany? Thank you.
Also wenn wir das verlangen würden, was die Therapie wert wäre.
So to answer your second question, if we answer our patient for that money, what the therapy is worth for them,
dann müsste sie weit über 3.000 Euro kosten.
then we should ask him much above 3,000 euros.
Da wir aber, sagen wir mal, ein vernünftiges, bezahlbares System anbieten
But
wollen,
therefore, that we try to be a fair system.
ist er der richtige Ansprechpartner
Now,
dafür.
he is the right person to ask that as far as Saudi Arabia and the rest of the areas is concerned. So you should ask them.
Aber wir haben die Behandlung so ausgerichtet in Deutschland und weltweit, dass sie für jeden erschwinglich sind.
But we have an arrangement for every country, so we have the target that every patient who suffered in that injuries is able to use our therapy. So therefore, it's not a therapy only for rich people. We try to reach all persons who suffers.
I want to ask if we accept the principle of the division of the cells, is there any risk of seeing anarchic cell division? That means cancer appearance in the space when we are applying this machine.
If I right understand, you are asked to side effects or to influence and cancer cells, is that right? You see, what we say to that.
Fragt nach den Tapes, ich will mal eben antworten, was das ist.
Ich denke mir, Entartung der Zelle ist geprüft im Labor, findet nicht statt. Zelllabor. Machen Sie
So it's not possible to, in using this therapy system, to bring a normal cell into the stage of a cancer cell. And the second is, if you ask for side effects or for the influence of the therapy in cancer cells, I should answer that a cancer cell has a different frequency. And if you talk about for risks, that is only that we say we are assured that we should be on the right side. Let me explain you an example. If a patient suffers in cancer, he needs normally 5 years that the doctor say, okay, it's gone. Now, if after surgery with cancer maybe 4 years is gone, and the patient drops into the therapy system himself, who would make the proof if he suffers again in cancer that it didn't belong to the therapy system? You can't give the proof. Therefore we say, if a patient suffers in cancer, leave him out, only to be on the security side. The same what we show with HIV. Nobody has done the proof that the therapy himself has any influence in HIV. But on the other hand, nobody can say that it hasn't happened. Or look at the peacemaker, the same. We hadn't any bad effects. We never seen bad effects on that. But we say, okay, be on the sure side. That's all.
Kann die Studien einsehen, die wirklich nachweisen, dass keine negativen Einflüsse entstehen.
So we have a lot of studies you can reach on the internet and as well as our partners. You see, we have double-blind randomized controlled who have the proof of all the facts we are talking about.
Hat schon geguckt? Okay.
Have you seen that?
Yeah.
That's very fine.
Yeah.
Is there any age limit to this therapy? I mean, from neonatal to any age limit up to from beginning to the end?
No, there's no restriction. You can have a child as well as middle age as the older ages. It doesn't have an effect on the age. You can use it for any age what you like to see. Me as an older one, you as a younger one, whatever you like to.
How often can you repeat the therapy?
Unbegrenzt.
You can do it as often as you like to, but as we explained, it's a loss of money. Normally, 7 hours or 10 hours, enough.
Sinnvoll begrenzt, immer in zyklischen Abständen.
No, not for the rest of your life, but we have the proof for 8 years. We have a study now from Austria with 4,500 people who says, okay, 4 years. That's a proved study. And we have our own observation for single parts of patient who says, okay, we see it in 8 years as well.
Aber noch eins dazu, das Feld, um das es sich handelt, ist 0,2 Millitesla, um mir eine Vorstellung zu geben. Das weiß er wahrscheinlich nicht.
But you see the strange of the field what we're using is 0.2.5 millitesla, as I explained. We didn't ask Teslas like the MRT does. It's a very huge field.
It doesn't affect the metal material, for example, plate and screws or anything. This couldn't interfere with this MRT or not?
If we talk about the MRT, then we talk only to explain the physical effects. And only to explain the way like the energy comes into the body. On the other hand, it's quite a different system. You see, no problem with that.
You think that this is one of the best modalities for treatment osteoporosis or osteopenia for prevention?
Absolutely. Ob das nach unserem Dafürhalten die beste Möglichkeit ist, diese Krankheiten schon im Vorfeld zu verhindern.
Ja, bei Osteoporose weiß er doch genau, was praktisch die heutigen Medikamente für Nebenwirkungen haben. Und hier hat er eins ohne Nebenwirkungen.
So let me start with the osteoporosis. You didn't have any pain if the osteoporosis starts. And if you use, for example, drugs or, for example, injection, you know all the side effects, what you have with injection, what you have with drugs. And here we have a therapy, also prevention. And in our point of view, it is the best thing for prevention because of the simple fact there is no side effect. And as far as the osteoarthritis is concerned, you have no possibility to recreate cartilage. Not with injection, not with drug. You can only cover, but no, there's no healing. In using this thing, if you do it on the right place, you can deny that a patient's suffering in that.
Using it in severe osteoporosis, I mean osteoporosis with fracture. Is there any benefit for the fracture to heal, to stop the process of like osteoblast formation? Because really, majority of cases we are seeing that severe osteoporosis advanced with fracture. Is there any place for MRT for this?
Yes, it's true that they have a good influence also if the bone is broken, because the osteoblast and the osteoclast will be moved very hard to recreate the bone cells. And therefore, normally, if somebody broke an arm and a leg, it should be very fast that it comes together. And on the other hand, if somebody lays in bed with a broken leg, it denies that the suffering of osteoarthritis as well.
Nur muss man eins sagen, bei Knochenbrüchen wird es nicht so häufig eingesetzt, weil auch, also solange keine Heilungsstörungen vorliegen.
But the normal way is that the doctors use it so often if the leg is broken. That's not the normal way in the moment. It's not the kind of the knowledge what we have. You know, until the year 1998, where this effect has been discovered, to now, in the whole business of medical, it's only a short time. I'm sure that we maybe look 50 years in the future, that it's well known as standard.
That MRT could be a modality for a remodeling of bone?
Könnte das ein Modell sein, grundsätzlich Knochen wiederherzustellen?
So my professor said I did not know it. Yes, you see, we only talk about injuries and we only talk about healing if we have the proof of that. If we have the proof for osteoarthritis, we talk about osteoarthritis, and we have it. If we have the proof of osteoarthritis, we talk about, and we have it. We see a lot of possibilities for the future where we are able to go to the patient and help them, but we have to have the proof. In the moment we have the proof for cartilage, for bones, for tissue, and therefore we tell about that. Maybe in the future we have the proof for liver recycling, maybe we have the proof for pancreas. We try on that, but as long we didn't have the proof, we didn't tell that.
Has it been used with secondary osteoarthritis? Secondary osteoarthritis, secondary to trauma, to intra-articular fractures. Secondary in arthritis, secondary to trauma. Any arthritis after fracture. And may I get my colleague's question right? Can it be used with an a metalwork in situ?
As far.
Yeah. I mean, can you use the machine while there is a metalwork in situ?
Yes, of course, but
because
you have medical metal. And medical metal is quite different to metal like these. You haven't any heating in that. The normal effect, if you go with some waves, on metal is that it becomes warm.
And we use metals.
Of course.
Alloy.
But medical metal. That's
Chrome.
all. Yeah. If we talk about metal that didn't come into the machine, that means from the table, for example, for tools, for example, but metal who's used in the medical area will be not affected. You can use it, of course.
Das war die Frage nach dem medizinischen Metall im Körper. Da kann man es ja einsetzen, weil es kein normales ist.
Nicht nur das, auch Nägel oder ähnliches oder Stents, was das Problem war.
So if you use stents or some other things that comes into the body, as I explained, you agreed with me, it's medical metal. And medical metal are quite different to normal metal. Yeah. Yeah. Right, but our system has no effect on that. Also understands not. You see, 0.25 millitesla. You can't affect it.
Also, es war etwas chaotisch, muss ich zugeben. Gell? Und ich denke mir mal, ich hoffe, dass die Grundzüge von dem, was wir gemacht haben, eigentlich so weit rübergekommen sind, dass man sie verstanden hat. Wer eine Nacherklärung braucht, soll gerne an den Stand kommen. Wir reden noch mal drüber und versuchen, das noch etwas klarer zu machen.
So as my teacher said, it has been a little bit chaotic. Sorry for that, but we hope that we are able to explain how it works and why it works from the basic. If you have special questions, we are very glad to see you on our stand. So thank you very much for attention.